Assalamualaikum warahmatullahi wabarakatuh, and a very good evening to everyone. My name is Dr. Shahrul Iskandar. Before I start, I would like to ask, is any of you love cooking, arts, or anything that requires you to use a sharp tools? If any of you love it, then may I ask if any of you ever experienced a clean straight cut caused by these sharp tools? If anyone ever experienced this, the wound is called incised wound. But don't worry, today I will demonstrate to you guys on how to treat incised wound. It is very important for us to treat incised wound properly and quickly to prevent the wound from become a chronic wound. Having a knowledge on how to treat the wounds properly can surely give us emergency care for us if we involve in any accidents in the future. Today, I will show you 6 steps on how you can treat an incised wound. So let's start with cleaning our hands. The first steps in treating the incised wound is washing our hands. We can wash our hands with water and soaps. It is very important for us to clean our hands to avoid from our wound to get infections. The second steps is remove clothing from the injured parts. We can tear our clothes. For it is very important for us to tear our clothes for us to get an easy access to the wounds. Let's move on to the third steps, which is apply pressure on the wound. We can apply pressure to the wound with our hands. It is very important steps to make sure to stem our blood flow. The fourth steps is to cover our wounds. Use a sterilized dressing if possible. You heard me? Use a sterilized dressing if possible. Do not just take any towel or anything that you found near the place. It may be that the clothes is already dirty or anything towel. So please be mind, use a sterilized dressing if possible. The fifth steps, before I forget, do not remove the sterilized dressing that you have applied on the wounds if it's already saturated with blood. Instead, put another new sterilized dressings to the wounds. So let's move on to the fifth steps, which is the second last steps of how to treat a wounds. The fifth step is raise the injured parts above the person's heart. For example, if you have wounds around your arms, raise it upper level from your heart. This will slow the blood flow to the wounds, so the blood will slow down and not be spread out. The last steps, which is the sixth steps, is seek for medical attentions. You may need to seek for medical attentions if you're bleeding, you cannot stop your bleeding, or you feel dizzy or about to faint. So to sum up, there is 6 steps on how to treat your wounds. The first step is make sure your hands are clean. The second step is remove clothing on the injured area. The third step, The third step is apply pressure on the wound. The fourth step is cover your wounds. The fifth step is raise your injured parts above your heart's level. And the last step is seek for medical attention. So it is very important for you to treat the wounds as quick as possible and in a proper way. It is to avoid any infections on your wound, as once we got a wound, our body is exposed to the bacteria. Last but not least, please refer to a doctor after you treat your wounds to further advice, because we're not sure if our step is still the perfect one. Like you may have washing your hands but it's still dirty. So to make sure that your wound will heal properly, please seek for a doctor for their advice. I think that's all from me today. Thank you.